Well, more now on the crisis facing our aged care system. We're joined by two people experiencing the hardship firsthand.
Anthony Bowe, his 78-year-old mother, Pat, is a resident in Sydney's Newmarch house and tested positive to COVID back in 2020. And 95-year-old Jack Wilson, a resident at an aged care home in Drysdale, Victoria, who's just been cleared after also testing positive. We thank you both of you for your time this morning. First to you, Anthony, how's your mum going?
Mum's doing well, considering the decline in aged care in the last 2 years, so she's hanging in there.
How has her treatment been?
Her treatment, is pretty basic now because of the staffing levels. Between furloughed staff continuously for the last 2 years and the amount of aged care staff that have left the industry because they haven't been supported, it's just basic care.
Hey, Jack, if I can ask you, because we've been talking for the last couple of days and weeks, what conditions are like inside aged care. How are you finding it?
Well, I've been very fortunate, really, because this aged care facility is top class. It's a privately run one. The girls are worked off their feet. They can't get the staff, but what they do well. We were locked up, but they maintained maintenance. They kept the place clean.
Hey, Jack, I love it. Jack,
That's my son.
Is it? Well, I'll let you talk to. We'll talk to you just for another couple of minutes if you don't mind, and then we'll let you go along with your day.
No, that's all right.
Okay,
that's
sorry.
Right.
I wanted to know, Jack, I know this is difficult because you're actually in this particular facility, but how have you felt when you've had to be locked up and isolated?
Well, not great. I'm not used to being isolated. I've always been an outgoing person. I found that it was a little bit like being in jail, but they were pretty good. I can't complain about this here, but I can complain about the treatment that aged care people have had. It's just, I can't explain. I get too upset to know that people are dying and don't really have to die because of the incompetence of the Liberal Party, particularly the minister. Well, he goes to cricket and there's 200-something people died on that day. And when he's in Parliament, I watch Question Time, he's always looking down at his papers. He doesn't know where he is, he doesn't know what's going on. He can't even tell people how many died the day before. He just says, I haven't got that information. It's a dreadful situation, really, a dreadful situation. A lot of it, I think, in the first place was due to profit. A lot of the aged care facilities didn't care, they weren't prepared, they weren't given the right instructions. There needs to be an inquiry into what can happen. There needs to be a standard set, and there needs to be a rise in wages for these kids because the $800 is just for vote catching, and it's not going to work because everyone tells me, well, $800, what's that?
Hey, Jack, just I can feel your frustration and your anger and also your genuine sadness and pain for those who aren't in a facility like yours. Why do you feel that so keenly?
Well, I believe every human's got a right. And if you're poor or rich, it doesn't matter. If you get into an aged care facility, it's the last port. Let's face it, I'm 95. So it's and I've got blood cancer as well, so I'm not going that great. But they just need to be looked after. We built this country. We fought for it. I did. My father died for it. My sister served in the army. So to see my country destroyed, it's breaking my heart, to be honest, because we're not looking after the aged care. You're just part of their problem. They're not looking after us.
Oh, man.
I'm lucky. I'm lucky because I've got into an aged care facility that cares about people.
I know you've got your wife there too with you, Jack. How's she going?
Well, she had the COVID, but she had the third booster, so she was fine. She still recognises me, but it's going downhill pretty quick, unfortunately.
Oh.
And, we've been married a long while. I'm sorry, but when you lose the love of your life, it's pretty difficult. We're very fortunate, though, that we are together in the same aged care. They never lost anybody during the COVID because as soon as it happened here, they shut it down straight away. Go away.
Okay. Well, I think, can I just say, Jack, thank you for being so open with us in a very difficult situation, and to hear you talking about the love of your life like that, it's beautifully said, but also what you said then, what resonates, what is in our minds is that you built this country and fought for it. You put your life on the line for it, and how do we repay you? You know, it's not good enough.
Something's got to be done about this minister. Like, he's no good. Like, he's just no good. I employed a lot of people in my life, and he'd be the last one I'd ever put in a job because he's so. I can't believe he's so bad. You think he'd have some intelligence.
Anthony, what are your thoughts on that? The Aged Care Services Minister, Richard Colbeck. How do you feel about his performance?
Well, his performance was pitiful 2 years ago. He was moved aside. This is now Greg Hunt's problem. The Prime Minister loaded up easily the hardest working Prime Minister on his front bench with the biggest problem, so that was problematic to start with. Now it's just a debacle. So, I mean, where does the buck stop?
So what are you going to do about your mum? How are you going to handle the situation, and what does the future hold?
Well, reinfection, we'll have that conversation. At the moment, there's 2 approved antivirals that are sitting on shelves that should be in every aged care outlet now. So on day 1, if you get an infection, your GP is informed and you put on those antivirals. That's one measure alongside the vaccine rollout. So there needs to be a 2-tiered approach. We need to look at giving income tax, a free income tax year for every frontline aged care worker, no tax for 1 year. We need to entice people back into the industry and keep the ones that are in the industry until we can take a deep look at how bad it is. I mean, we need to look at field hospitals as an option for our young that don't need acute care, so that they can have the opportunity to give up their hospital bed for an elderly person, and we can actually save some lives. So there needs to be more debate, not less.
Yeah.
And Jack, just from you, some final words, if you will, please.
Well, I think they've got to change their system. They've got to put in some way. How can I put it? With the aged care facilities, they should be put in a standard which they need to keep. Otherwise, it close them down.
Thanks for being with us, Jack. And Anthony, thanks for articulating the problems that you see. We really appreciate it. It's part of an ongoing discourse, and we won't stop either. Thank you for your time.